Documenting substance use can be challenging when developing evidence for Social Security disability applications. Understanding the concept of materiality is essential for applicants with co-occurring mental health and substance use disorders. First, let's take a closer look at the word materiality and break down what it means for Social Security disability eligibility. SSA regulations charge DDS examiners to determine whether, quote, drug addiction or alcoholism, unquote, is a contributing factor material to the determination of disability. They are deciding whether they would still find the applicant disabled if they stopped using drugs or alcohol. This means that SOAR caseworkers need to provide accurate and convincing evidence illustrating that a person's substance use is not what keeps them from being able to engage in substantial gainful employment. Social Security needs to understand that even when the applicant is not using any non-prescribed drugs or alcohol, their impairments remain. When we provide this information, Social Security can determine that an applicant's drug or alcohol use is not material to their disability. It is important to know that a person does not need to stop actively using drugs and alcohol while applying for disability. Do not hide or avoid addressing substance use with Social Security. Details about substance use will be discoverable in the clinical records. Addressing it upfront and providing helpful context will be key to showing that the use is not material. Begin the substance use section of the medical summary report with a brief review of how and when the applicant's substance use began and how it progressed over time. If someone began using marijuana and drinking in their adolescence and their use progressed to cocaine and other drugs as they got older, you should describe what factors led to the progression of substance use. Describe what mental health symptoms or trauma experiences impacted the applicant's substance use when possible. Once a rough timeline of the applicant's substance use history is established, focus on documenting the role of substance use in the applicant's life today. If the applicant is still using drugs or alcohol, describe how the applicant feels before and after the use. Then describe how the applicant functions when not using substances. Substance use treatment, jail, and hospital records can serve as valuable evidence. A SOAR caseworker should document when a treatment record provides evidence of a negative toxicology screen, meaning no drugs or alcohol are found in the applicant's blood and/or urine. Follow up this documentation with direct quotes and citations from the clinical records that describe the mental health symptoms the applicant experiences during periods of documented non-use. This information will illustrate to Social Security that the applicant still experiences symptoms and functional limitations when they are not actively using, meaning their substance use is not material to their disability. When a SOAR caseworker takes the time to illustrate that substance use is not material to the applicant's disability, people with co-occurring substance use disorders are much more likely to receive a favorable decision from Social Security. Thank you for helping your applicant SOAR.